Hi everyone, I am Dr. Vinayak S Hiremath, practicing endocrinology, diabetes and obesity at KMK Hospital, North Parur, Cochin, Kerala. So today I am going to talk about one of the important mission we are going to do in our continuing series, that is mission organ protection. So in that I have chosen very important topic, the most pandemic topic, that is obesity and its complication. So I'm going to talk about obesity. What is obesity? Let's try to define what we know about obesity. Obesity is a complex disease involving an excess amount of body fat. Obesity isn't just a cosmetic concern, it's a medical problem. It increases the risk of other diseases and health problems such as heart diseases, diabetes, high blood pressure and certain cancers. So we need to focus mainly on the obesity as an health concern but not as an cosmetic concern. As per WHO data, if we look into almost 39% of adult aged 18 years are overweight, and this data is from 2016, and 13% were having obesity. So let's try to see why India is seeing a lot of obesity suddenly. What are the causes of obesity? So obesity usually results from a combination of causes, contributing factors, especially first the family inheritance and influence. So this is where many of us lie. That is the gene you inherit from your parents that affects the amount of body fat you store and where that fat is distributed. So this is going to define how your obesity is. Especially some of us have on the trunks, some of us have on the buttocks, or some of them have on the chest. So it depends the distribution, how it is in the family inheritance. And second thing is unhealthy diet. A diet that is high in calories, lacking fruits and vegetables. Because we always focus on consuming carbohydrate diet rather than focusing on proteins and fibers. Then third thing is liquid calories. Many of us drink many calorie rich drinks, especially when you feel hungry or when you are thirsty. You try to drink a sugary drink, soft drinks or alcohol. These all causes the weight gain. And the fourth most important cause is inactivity. If you have a sedentary lifestyle, especially with the corporate jobs and many of us having an office jobs, even we doctors stick to the table or chair. So our life becomes more of sedentary. We can't burn that amount of exercise, the calories through exercise by our daily activities. So this also increases the risk of obesity. And there are the next causes is certain diseases where you have Cushing syndrome or Prader-Willi syndrome, or certain types of medications you are prescribed from your doctor, like anti-seizure medications, beta blockers for heart diseases, steroids, or some antipsychotic drugs, or if you are suffering from depression and taking medication for that. So these can also cause the obesity. Then next, fifth thing is pregnancy. Yes, definitely pregnancy, weight gain is common during pregnancy, but what happens in our setup is, especially in India, some women try to keep this weight for lifetime and not lose it after pregnancy. And the sixth cause for obesity, what we see, is lack of sleep. Sleep is very important in terms of regulating your hormones, especially your appetite hormones. So if you are not having a proper sleep, your appetite is disturbed. You tend to choose the unhealthy foods, right? And the last thing is stress. Yes, we all are in stress world, where that is also one of the reasons why we see a pandemic of obesity developing in our country. So how does this obesity affect my body? Let us try to learn about that. Obesity can cause numerous health diseases, as I mentioned earlier, but developing a potential complications include especially the heart diseases such as high blood pressure, stroke, heart attack, or any kind of heart issues. And then the lifestyle disease, the major pandemic, type 2 diabetes. This is where many of them develop the insulin resistance and develop diabetes. And then we have high cholesterol, sleep apnea, asthma, back pain, or even the non-alcoholic fatty liver disease. Now this is again the one of another pandemic which is going to hit us because of sedentary lifestyle or obesity. And then when we are obese and not shedding the bone problems like osteoarthritis, joint pains, and certain cancers are also more prone to the obese people. Then digestive issues, definitely will have heartburns, acid peptic disorders, gallbladder diseases like stones, liver problems as I mentioned. And this all leads to you in state of mental depression. So mental health issues also starts to develop, and then you will have a decreased quality of life. Understood? So these are the factors which are going to affect your health if you are obese, apart from the cosmetic concern, right? So how can I prevent overweight or prevent the obesity or try to reduce the obesity? So the first thing you have to remember is limit the energy intake from total fats and sugars. Always try to focus more on the proteins and fibers. Increase the consumption of fruits, vegetables, legumes, whole grains, nuts, etc. kind of fruits. And never forget to induce a regular exercise, a physical activity. It's like walking, swimming, jogging, whatever kind of physical activity you want to do at least 60 minutes per day or 150 minutes spread through the week. So this will make you more burn the calories and keep you active, so you can reduce the risk of developing obesity. In a way, you can increase your BMR, decrease the calories, include all types of fruits, and let's all together try to beat the obesity.